Okay, so I think we are good enough to go. I think let's start, right?
Yeah.
Yes, sir.
Okay, fine. So let's start the quiz. Over to you, Rupal and Manoj.
Yes. So the first question is right here.
On examination, the blood smear shows target cell and on hemoglobin electrophoresis, there is increased level of HbF. So what is your diagnosis? So there's a skull lateral view X-ray. I hope you guys can make it. Let's see the answers now.
Looks electrifying.
Yeah, so
Wonderful.
I think this must be the easiest question of today's quiz.
Yes.
So let's see leaderboard. I think the one with the fastest fingers will get this. Dharani is in the top with 92. And you see the difference. It's just 92, 91, 91. So we have two people at second place. Quite impressive. Okay, let's move on to the next question.
A 30-year-old.
Yeah, please continue.
A 30-year-old patient had episodes of fever, cough, and weakness since 2 months. Later, he was diagnosed and treated, and the treatment was started. Now he has developed anemia, initiating the treatment. What type of anemia is seen? Guys, there is an X-ray. There is a hint. This got to be easy. Is it? Oh.
We have got 8 of them.
8 of them. Good side they're going.
I think this is one of the tough questions because even I was doubtful if options were not provided. Okay, let's see the leaderboard. Oh, it's Tanya at the top now, followed by Charan, Dharani, dummy account, Vamshi.
Guys, you got to write your own name because when we provide your certificates, it's got to be your name. I don't know if you want to be addressed as dummy account.
Let's move on to the next question.
Which of these is Hind's body? So you guys have to identify which one is the Hind's body here. So let's see, let's test your image knowledge here.
You can spot the abnormalities.
Five seconds to go.
Okay,
so we have equal distribution.
Yeah. Let's see the leaderboard. Okay, now it's Charan, followed by Vamshi, then the agent, Dharun, Tanya, Dharani, Narayan, Soumya. Okay, and we have so many people below that also. Okay.
Great.
So, guys, there are 7 more questions. So, let's go on to the next question.
This time the table is changing very fast, sir. You can see.
Yeah. People, every question is your chance to be on the top of the leaderboard.
So this is a riddle, guys. When I am with you, you can feel every step and every touch. But when I am gone, you will stumble. Who am I?
It's definitely a deficiency, isn't it?
Everyone has got it right. So this is a very cleverly framed question. So I think you can feel every step is for sensations, right?
Yes, sir. Yes.
So its deficiency will cause peripheral neuropathy. Okay, but when I'm gone, you'll stumble those posterior column lesions. I think you're talking about SCID.
Ataxia.
Yeah, ataxia, correct. So let's see the leaderboard, and this time I'll scan slowly. So we have Vamshi at top, then Charan, followed by Agent. Then we have 4th place Darun, 5th place Tanya, 6th place Dami, 7th place Dharani, 8th place Narayana, 9th place Soumya, and at 10th place we have Shan Priyan. So 5 more questions to go. Sorry, 4 more, right? Okay, so let's move on to the next one.
Guys, this question. Arrange the following in correct order. This is the story of maturation of RBC. I hope you're ready with your answers. And
I say this is an important question, knowing basic life cycle of RBC, but still like only 5 people got it right, the correct order. So it's time, guys, to go back and see that image in your notes. So let's see leaderboard, and we have again Vamshi is leading. Vamshi has got the longest streak. He has got all 5 answers correct.
Amazing going.
Followed by agent, dummy account, Charan, and Dharan. Good, guys. So let's go on to the next question, the 6th question.
Keep it lit, guys. Over here, all you need is presence of mind. This is, and there's a hint as well. Wow. At least majority of them got this one right.
Yeah, but why did 2 of them answer hemolytic anemia? So I'm really worried now. Like there is nothing that points towards hemolytic anemia as such.
Yeah.
Let's see the leaderboard.
I think they overthink this question.
Yeah, we have one of the participant in live chat also in YouTube, Sarabjit Singh, who has given the right answer for this question. Congrats, Sarabjit. So right now we have a leaderboard with Vamshi at top, followed by Charan, and you see and we have agent also at second place. I think this is very rare because the quiz it depends on time and accuracy also. So these both have very tough competition, followed by Tanya and Tharun. Let's move on to the next question.
Be present, read the question slowly. You will know the answer.
So thalassemia, sickle cell anemia, G6PD deficiency provide protection against which disease? I think you all guys will get it right.
What do you think, Manoj? What would it be?
I think I'll go with option B.
B. Let's see.
Let's see. Okay.
Thankfully, no one has answered measles. Okay, so here we see things changing. So now Charan is at top, followed by Tanya, then Dharani, then we have Shan Priyan, then we have dummy account, followed by Dharun. Soumya is at 7th place. Vamshi, I think Vamshi has made one wrong. That's why has skipped to 8th place. Then agent, and then Manoj.
Right.
Good, guys. 2 more questions to go.
You guys are doing just great. Wasn't MBBS course enough that we have to remember this test as well?
And I think this test is taught in physiology, it is taught in biochemistry, it is taught in pathology, and again in medicine. There are 4 places we read about this, and still clinically we don't do anything. We just order vitamin B12 levels, nothing else.
Nothing else.
Every time we read it to forget it on ourselves.
Okay, so I think people answered differently. Say some of them have answered intrinsic factor. I think we should give grace marks for this because we didn't reveal that all should be in capital letters.
No, I think, sir, the answers are accepted if it is anywhere
Okay,
like
okay,
related or
okay,
spelled with that.
okay, fine. Okay, so we only had two people who have answered this right. Okay,
So
if you had
I
answered full shilling test, they would have got right.
got it. Yes, yes.
Okay, okay.
Even with a
I think this.
spelling mistake, they would have got it.
Okay, okay. So I think this is the first time the different questions. So maybe participants will be accommodated, adjusted to this in the coming sessions.
Right,
These
right.
type of questions. Let's see leaderboard. Okay, here we have Tanya. Tanya had answered it right, I guess. That's why Tanya has got points.
Right.
Okay. So let's move on to the next question.
Guys, you know this. It's a triad of 3.
So
This is also associated with microcytic anemia.
It is also known as Kelly-Brown syndrome.
Okay, I think now they'll get it. So yeah, right. So most of them have got it.
Wonderful.
Plummer-Vincer syndrome. I don't know why 6 people have answered iron.
No, so
Okay.
it is right.
It
So
is a right.
Okay, it is right. Okay, okay. It is
Yeah.
related to what? Okay, okay,
Yeah.
okay. In relation to the deficiency. Good question, good question. So all this, how many? 22 people have got it right.
Wow.
Okay, fine, good. So we have Tanya leading, followed by Charan. Then we have dummy account, followed by Hemant, and then Dharun and Dharani. Then Shan Priyan, Soumya, Agent, and Vamshi. So good guys, we have last question. So think and answer quickly.
The first cell in peripheral blood and first cell with no nucleus is.
This is really a tricky question. These questions are very common in INI-CET exams.
Yes, they are.
So in our YouTube live comment section, we have Sarabjit Singh, who is continuously answering all these questions. So I think he couldn't join the quiz. So next time, definitely Sarabjit will be telling you the details of this quiz. Okay. Reticulocyte is the correct answer. Okay, so the final leaderboard is Charan has bagged the first place.
Congratulations.
So
Charan.
Charan is the winner. Congratulations, Charan. Followed by second dummy account, but since the name is not mentioned, so we won't give any prize to dummy account. Sorry, dummy account. Third place is backed by Tanya.
Oh, wonderful.
And fourth place is Hemant. At fifth place, we have Dharun. Sixth place, we have Dharani. Seventh place, we have Shan Priyan. Eighth place, we have Agent. Sorry, Agent, no prize. Ninth place, we have Manoj. And at 10th, we have Narayana. Awesome, guys. So congrats, everyone. So come back to YouTube Live. So here we'll be having a class now. Okay. So we'll be saying where you went wrong and what extra you can do so that you don't commit the same mistakes in upcoming NEET. So over to you, Manoj and Rupal.
Yes, sir.
Right. So guys, this is just a small overview about the quiz, like what the questions we prepared, what the topics we chose, and how
Okay,
it goes.
just a minute, Rupal. I'm sorry to interrupt.
Sure.
The winners, that is Charan, who was at second place. Okay, top 3 winners. Okay, other than that dummy account. Okay, first, third, and fourth place. Kindly contact me on Telegram. Okay, so on Telegram you will find Dr. RMD YouTube channel. Dr. RMD Telegram channel. Contact me there. Okay, so that we can let you know the next proceedings regarding the winner. Okay, so regarding the prizes. So winners of this, that is first Charan and the third and fourth place. Okay, these three people, kindly text me on Telegram on Dr. RMD Telegram channel so that you can get your prizes. So we'll be having prize distribution of this session in the next quiz. Okay, so now we'll be seeing the classroom aspect of this. Over to you, Rupal and Manoj.
Right, thank you, sir. So guys, this is just an overview, and I hope all of this is just helping you up. So let's start. Over here, we have the RBC maturation cycle. So these are the phases that RBCs go to become a mature RBC. Right now, the phases that I'll be telling you are present in the bone marrow. It starts from the hemopoietic stem cells, goes to proerythroblast, then goes to basophilic, and then goes to polychromatic, and then it goes to autochromatic. When the autochromatic comes in the blood, it forms a reticulocyte, which in turn becomes mature RBC. Now, basically, reticulocytes are usually not taken, so we use corrected retic count. Retic count into hematocrit divided by 45 is how we calculate the corrected retic count. Now, when the result comes in and it is in percentage, so if it is more than 3%, it is either known as marrow, the marrow is normal, or either it is known as a peripheral destruction. What does a peripheral destruction mean? It means that there is some destruction in the peripheral system and the marrow is normal, which is termed as hemolysis. Now, hemolysis is again is divided into two parts: the extravascular and the intravascular. The extravascular comes with two parts again, that is hereditary spherocytosis and sickle cell anemia. And now we are coming to the intravascular side of the hemolysis, where you can find PNH, G6PD deficiency, immune hemolytic anemia, macroangiopathic hemolytic anemia. Now, this was the part where the percentage is more than 3. Now, when it is less than 3%, there is definitely a marrow pathology present. Now, the marrow pathology can be of two types. Either it can be a aplastic anemia or it can be a Fanconi anemia. The reasons for aplastic anemia are HIV infection, parvovirus B90, and the other kind of anemia would be Fanconi's anemia, that is seen in short stature, and it shows ectopic kidney and hydrocephalus. Please don't confuse it with Fanconi syndrome. Fanconi syndrome is a renal tubular acidosis type 2. And with this, over to you, Dr. Manoj.
Thank you, Dr. Rupal. So, continuing the discussion, we had a question which states that the patient had fever, weakness, cough with hemoptysis since 2 months, and the chest X-ray showed a cavitation. So the diagnosis was tuberculosis, and ATT was started to the patient. So we all know that isoniazid is a part of ATT schedule. So when isoniazid is given, it causes vitamin B6 deficiency. Vitamin B6 is actually an important cofactor for ALS synthetase, which is involved in the formation of protoporphyrin. As a result, when there is a vitamin B6 deficiency, there is no ALS synthetase activity, no protoporphyrin, leading to an anemia, which is called as sideroblastic anemia. Or in other words, you can say it is an iron overload stage. And also, there's one more drug we have to remember, that is methotrexate. Methotrexate drug causes vitamin B9 deficiency, leading to macrocytic anemia. The next question will be explained by Dr. Rupal.
Okay, so guys, we had a question regarding vitamin B12 deficiency. You know, when B12 decreases, it causes subacute combined degeneration of the spinal cord, and which And in turn, it causes loss of vibration and proprioception, which leads to ataxia, uncoordinated gait, and memory loss. The patient could also complain of atherosclerosis as the homocysteine levels are increased. Let's continue with Dr. Manoj.
And also there was a question on thalassemia. So thalassemia here, as we know, heme part is actually normal. That means to say that iron and protoporphyrin are normal. The defect in thalassemia is mainly in the globin chain. It may be in the alpha chain or in the beta chain. If the defect is seen in alpha chain, it is termed as alpha thalassemia, which can present as a mild form or a severe form. Mild form mainly has a little mild anemia, whereas severe form can lead to hydrops. Whereas in beta thalassemia, we have two kind of presentation, minor thalassemia and major. Minor, we have one normal beta gene and one more beta gene is actually defective. Whereas in major, we have both the beta genes defective. In minor beta thalassemia, we can see target cells, and on electrophoresis, we can see more of fetal hemoglobin and the HbA2 type of hemoglobin. Whereas in major, we see the same findings, that is target cell, HbF and HbA2. Along with that, we can see crew cut appearance of the skull and hepatosplenomegaly as well.
So before you change the slide, I would like to mention, guys, that was the question where you had seen the X-ray, which was looking electrifying, right? The crew cut skull. Okay. Coming to this question, guys, this was like you have to be just reading the question right, because it was very much in front of you. Everything related to the topic was there. So you just need to be present. Sometimes the answer is just in front of you. For the basic knowledge, here we go. Iron deficiency anemia basically means decrease in iron leads to decrease in heme, which in turn give rise to microcytic anemia. Now there's a triad which is associated with IDA, that is Plummer-Vincent syndrome. It is a triad of esophageal web, atrophic glossitis, and anemia. Because of this triad, it can also cause dysphagia. And Dr. Manoj.
And coming to the last slide, so this slide has some of the important image-based PYQs here. So starting from the top column, on the top left, we have spirocytes. Spirocytes, these are the cells which do not have a central pallor. You can see that in the image. And beside that, we have basophilic stippling, which is seen in poisoning cases like lead poisoning. And the third image is a Heinz body, which can be seen in G6PD deficiency anemia. Coming to the lower column, we have target cells, which is classically seen in both minor and major thalassemia. And the middle image on the lower column is sickle cell, where there is sickling and desickling phenomena, which can be seen in sickle cell anemia. And the last image show Howell-Jolly bodies, which is nothing but remains of nuclear fragment in the RBC cells, which can also be seen in sickle cell anemia. So this was the recap of RBC disorder. Hope you like it, and see you all in the next session. Thank you, guys.
Guys, before we end this, I would just like to mention that we have today completed with the microcytic anemia and megaloblastic anemia and the life cycle of RBC. So this way, you know that what you have read and what we have completed as well. Thank you all for this time, and happy Dhanteras to all.
It was a wonderful presentation, Dr. Rupal and Dr. Manoj. So
thank you, sir.
I got to learn a lot being a pediatric PG. These are the diseases which we come across frequently. And the question that I liked the most was regarding sideroblastic anemia. I was like, how do you connect a like cavitary lesion in the lung to sideroblastic anemia? And then I realized that the patient was on NEET-PG. Okay, it's a very good connection, and all these connection type of questions are used in for NEET-PG and INI-CET. So it was a brilliant session. So I think
Yes.
uh,
So
in
hope
the
some
upcoming,
examiners see this question and we'll get the same question in the exam.
yeah, it's very much possible. Okay, so right now we'll be in the upcoming session we'll be having WBC disorders, right?
Right.
Yes,
Yeah,
sir.
so we'll be having WBC disorders. Probably I will inform you the date and time in the Telegram and WhatsApp channel also in the Telegram group. If you have any query or feedback related to this, you can approach us anytime. There is Dr. RMD Telegram channel also where you can text me directly, or you can leave feedback during your quizzes also. So thank you everyone. So we'll see you in the upcoming next session. Next topic is WBC disorders. Shan Life. Okay, who has commented? Okay, next topic is WBC disorders. Okay, so it was nice playing with you guys. So we'll be seeing you in upcoming session. Thank you.
Thank you all.
Thank you.
Thank you.